Welcome back. If you didn't know, due to recent changes, Medicare open enrollment is already in full swing and the deadline is earlier. Now is the time for seniors to make changes to their Medicare coverage for the next year. Here to tell us about the process, Dr. Jud Fisher with Healthcare Partners Medical Group. Good morning and welcome back.
Good morning. Thank you.
When did open enrollment start and when does it end this year?
It started October 15th, so it is on now until December 7th. So it's very important that Medicare recipients take advantage of this and make their selections. They only have 4 weeks left, and there is no grace period as there has been in previous years.
So they stopped that part, the grace period.
Correct.
So
December 7th is the last option.
So definitely you need to go through that booklet that they give you. And let's talk about some of the changes that you've noticed.
Well, there's constantly changes in Medicare Advantage plans that may impact different patients in a different way. And that really makes it necessary for patients to go ahead and examine their coverage every year to make sure they get what they want out of their plan. You could get better cost, better coverage, or sometimes both.
And do Medicare Advantage plans typically change every year, or they usually stay the same?
They often change. What they will cover, what they won't cover, co-pays for visiting physicians, co-pays for specialists, hospital co-pays, emergency room visits, etc., all change virtually annually. So it's important for the recipients to make sure they examine their Medicare Advantage plan.
Just because you had that plan last year doesn't mean your grandfather did, and you have to make those changes and check the box.
If you decide to change to a different plan, you must make that change, correct.
And some viewers have received a letter in the mail saying that their healthcare partner's doctor is no longer covered. What was this letter all about? And that's not the truth, is it?
No, it's not, Dowd. The truth is that these Medicare recipients just need to make sure that they select a healthcare plan that covers healthcare partners so they can maintain their physician. More information on this is available at www.keepmydoctornv.com. At Healthcare Partners, we value the relationship that we've had with our patients over the years, and we want to make sure that we keep this relationship going and are able to take care of these patients, each and every one of them.
A lot of these seniors have relied on the same doctor for years to treat them. So for them to wake up one day and realize that I didn't make these changes, therefore my doctor isn't under this plan, it's going to be very tough on them.
It can be very frightening. The relationship that patients have with their physicians over the years is a very personal relationship and a building relationship that must be preserved, and we're hoping that patients make the decision by December 7th so they can keep their healthcare partner's physician.
Well, you operate on a model called Total Care. What is that?
Total Care is a mechanism that we have a team of healthcare providers, physicians, nurses, home health, hospitalists within the hospital that organize the care to make sure that we're doing the best we can for our patients to provide value and quality, excellent care, and that information along the way at every step of their healthcare needs is communicated to all members of our team so that we're not duplicating and sending the patient running around doing things they don't need to be doing and providing quality care.
And how is this different from traditional healthcare?
Oftentimes, quote, traditional healthcare is very disjointed. One physician may see the patient, order some tests, and then the patient goes to see a specialist. The communication is not there. We're duplicating processes. We're not communicating about subtleties of that patient's needs, their family needs, and what their real medical issues are.
All right, and let's talk about some things that seniors need to know when it comes to taking care of themselves. What sort of things should they be always tested for yearly or on a bi-yearly basis?
Well, one of the most important things we're looking at is trying to prevent problems down the road. Preventive care is part of the total care model. We want to make sure that seniors are having annual eye exams, that if they're diabetic, that we're checking to make sure they're reaching their goals for control of cholesterol, control of their blood pressure, controlling their glucose levels, and a whole realm of things that are so important to make sure that we're not having problems. We want people to live active, healthy, successful lives in their senior years, and we're willing to be a partner with them to make sure that that happens.
Yeah, and that's part of that whole total care philosophy, and you guys have a very big network of doctors that you can refer to as well. Tell us about that.
Right now in Las Vegas, Henderson, Pahrump, and Boulder City, We have roughly 50 medical office locations and approximately 250 physicians that we're working with through a coordinated network to make sure that we're providing for the patient's needs.
Okay, again, one more time, when is the deadline for open enrollment?
Deadline is December 7th. There is no grace period, so they have a little bit less than 4 weeks to get this taken care of.
All right, some good information for us. Thank you so much, Doctor.
Thank you very much.
Healthcare Partners has clinics in Vegas, Henderson, Pahrump, and Boulder City. Dr. Fisher's office is located on North Nellis Boulevard. For more information, call the number on your screen or check out their website, keepmydoctornv.com. Still ahead.